UK or Irish, you will have long clinical consultation. In the clinical consultation, you will have outside 5 minutes. You will have scenario for some complaint, maybe one or two complaints, maybe giving you like some data or some vitals of the patient. And then you will go inside with the patient. You will have 20 minutes. 20 minutes, you will have 15 minutes with the patient and 5 minutes with the examiners. With the patient, after 13 minutes, he will give you alarm that it's 2 minutes remaining. So mainly for the concern for the patient. So we have in this long clinical consultation now to have taking history, examine the patient, and answer his concern. Then with the examiner, he will ask you what are your physical finding, what is your finding, and then what's your differential diagnosis, and how you will manage the patient. Okay. The long clinical consultation. Now I will just talk with history taking. I read my scenario from outside, then I will go inside with a surrogate. I just will start with what was introducing myself. Hello, I am Dr. Muhammad, the doctor in the clinic today, or the doctor in the ward today, or the doctor in the emergency today. I forgot what I am, the charge. Hello, I am Dr. Muhammad, I am the doctor in charge today. Don't mention anything if you forget it, okay? Prefer to introduce yourself with the last name according to the UK. Then I will tell him, I have been asked to talk with you and examine you. Is it okay with you? I will take permission from him. And then confirm the confidentiality and that I am listening, because I will take some notes. So during our conversation, I may need to write some notes. They will be confidential. And I'm still keeping attention with you. Is it that okay? Yes, doctor. So this is like brief introduction when we introduce, and then what before this a check for was him. Am I talking to Mr. Ahmed Ali, 35 years old? Yes, doctor. If it's the name is right to you outside, please. It's good to tell the patient the name. That means that you are reading the scenario well. If you don't have the name, can you confirm your name and age, please? Okay. If you forget. If you get inside and you forget the name, don't panic and just ask him, can you confirm your name and age, please? Okay. But it's better if it's written from you outside, tell him this. So I start to this. I confirm myself, check the identity of the patient. Then I tell them, take the permission, tell the permission for the notes. Then I will tell him, it came to my knowledge that you have troubled with like a rash. You have troubled with headache. You have troubled with difficulty in swallowing. Okay, so he will start to tell me. Here it will start my task. Your task in the history, the main frame for the history is these things. First is a complaint. I mean, you have a complaint like rash, like headache, like whatever. So you will verify this complaint. What I mean by verify, some candidates will enter, you will have like fatigue, or back pain, or tummy pain. Okay, then you will start to analyze the pain. Where is the duration, onset, course, blah blah blah, and you don't understand what is this. Sometimes you need to verify first is a complaint. So don't be afraid to ask the patient, what do you mean by this? What do you mean by fatigue? What do you mean by abnormal sensation? What do you mean by this, dizziness? What do you mean by this? Okay, so we will start to giving you some information that will help you to put your differential. Okay, he tell me about the pain. Verify it. I mean, where is the pain? Just before anything, he has back pain. Where is the back pain? He has abdominal pain, tummy pain. Where is the pain? So he will just leaving you all over my tummy. Okay, he may point you. It's on the right side, doctor. So you, from the first minute, you know this is your differential for right hypochondrial pain, for instance, like this. Well, is this fatigue, doctor? Well, I have back pain, doctor. So it's not fatigue, it's back pain. Well, doctor, dizziness. Well, doctor, I collapsed. I lost my conscious. So I know from the start my differential. Then I will, after verification, I will go for what analysis of the components. How I analyze this? You can use many items like Socrates for pain and Odibara. But for myself, I bought for myself this is like history, or sorry, a story. There is a doctor, his name is Bet, okay, and he got TB once. Since then, he gets confused. So Doc Bet get confused since TB. Okay, this is like mnemonics. You can get it in any symptoms. I will tell you what is the meaning of this mnemonics after just 1 minute. So I will analyze the complaint itself and got all of this dog bed get confused since TB. Then after I analyze the complaint, go for the system related. I mean, I have chest pain, so the system related is a cardiopulmonary. I have headache, so go for neuro. I have tummy pain, so I will go for abdomen. Okay, so the system related. Then your differential diagnosis. What is my differential? When you have this 5 minutes, the 5 minutes outside, you have two tasks. You have to put differential for your case. I mean, I have this, he tell you from outside, this patient has acute headache. So from the outside, I know this is a differential of acute headache. What is a differential? I will put the differential and then get my systems. What I mean? Mostly one of the problem in the communications that you will face you as a candidate is that the examiners always comment that you are unsystematic or haphazard. You are not professional. Why? Because you will get your differential. Sometimes differential, when you memorize it, it will be like sometimes some causes from the chest, some causes from the neuro, some causes from the endocrine, and you will just asking about this differential when you get inside. Okay, so I will ask some questions about neuro. Then I will ask about the abdomen. Then I return to the neuro. Then I go for abdomen again. Then I go for heart. Then go for. This is getting the examiner irritated. Why? Because he doesn't understand where are you. You check the neuro, so you go for the other system. They like this, okay, because they will be confused. They will not understand why you are just jumping from one system to another, then return to the same system. Okay, so I need to verify from the start what my system I will be like. In this case, I will ask about this chest pain. I will ask about the chest cardiopulmonary and finish it. If my differential from my differential there is a problem in general fever or endocrine. So I will go for the endocrine system, but I will finish all the cardiopulmonary from the start. I will not ask about any chest pain, any awareness of heartbeats. Then I will go for this irritation and weight loss. And what about your period for thyroid? Then I return for the other symptoms of the chest, like noisy breathing, you cough. No, finish the system that you already asked about. Just if you just ask about system, finish it. Okay, and then this is my differential. Then we will go for this PDF. This is past medical history, drugs and family history. Then just sad. This is job, impact, social, smoking, alcohol, driving. I will tell about it again. So just I will memorize it to make the frame for you. Okay, so I will ask about the job impact. Very important. It's one of your skill in the communication with the patient to ask about what the impact of the symptoms, whatever it. Okay, so I need to ask what is the impact, how does it affecting you and your daily activity, your job, because this is one of my skill in the communication. Then asking about smoking, alcohol, driving, because it may affect his health, it may have hazard with this, and the driving for the safety. I will tell you all of this now. Then the 4 Bs, if she is female, you will ask about the 4 Bs. It means related to the period, pregnancy, abortion, bills, all of this. Then you will have the system review. The system review, we have this mnemonics, CCC, it's CNS, cardio, chest, then GGG, GIT, genitourinary, general, help, help H for hematology, E endocrine, L locomotor, rheumatology, B for psychiatry, and T trauma is skin. Okay, so this is your system. From here, from the complaint, verify analysis of the complaint, system-related, differential diagnosis. This is the order you should have for all any case. After that, you can change here. I mean, I want to ask about smoking first and this job social impact first because I think this case is just and it's important to ask about smoking. Okay, you can change and ask before this. Well, I want to ask about this abortion because it may be this systemic lupus antiphospholipid. So go for ask it before it. Okay, no problem. But just as any system, once you ask about one, complete the ask. I mean, I want to ask about post-medical history in this case. Okay, ask about medical history, ask about the drug and family history with it. Why? Because you will forget in the exam. You may forget what I asked and what I should ask. You will repeat your questions. How I solve this problem. Just when I get any system, I finish it. So I just put a tick in my paper that okay, I already finished PDF. I already finished just South. I already finished 4 Bs. I will not ask about abortion. Then return for other causes, then return to ask about pregnancy. No, complete innocent. Okay? This is the main frame that you have for this. Let's start one by one. The first one is the complaint. As we said, first we will verify this complaint. We will want you to understand, just ask the surrogate one question. What do you mean by this? He will start to explain for you what is this complaint. Then any complaint, this dog bit get confused since TB. Dog, it's D for duration, okay? How I ask for it? For how long do you have this? And the onset, how does it started? And the course, how does it progress? Or can ask him, does it improve or worse or the same? Why I choose this from the start? Because any symptoms you have, you will find that you have like headache. So it's acute or recurrent or chronic. A tummy pain, is it acute or chronic? Any symptoms, the first thing you want in your differential to understand, is it acute problem? Is it chronic problem? Or is it recurrent? How I know the recurrent? By asking the B. B, any previous attacks. Any previous attacks before? I have headache, doctor. Okay. Do you have any headache before? Yes, doctor. Is it the same or no? Well, it's the same, doctor. So we're dealing with the same headache that he has from the start. No, doctor, I used to have headache, but it was like migraine and I was diagnosed as migraine, but now I have another headache. It's different. So now we have another problem rather than the previous one. Okay, so by asking these questions, I now understand I am in acute, chronic, or recurrent problem. Then asking about what timing. I mean, this problem, do you have any specific time? Morning, night, season, in a specific season. Why ask mainly the timing? It will help me a lot in cases of myasthenia gravis. I mean, the myasthenia gravis, you will discover it when you ask about the variation. Well, doctor, I have shortness of breath. It's increasing morely at night. Well, doctor, I have difficulty in swallowing. It has this diurnal variation. It's increasing when I get night. So myasthenia gravis will help me in this. And other things like we have this night. Well, doctor, the severity, like the pain, it mainly increasing at night. I have back pain mainly at night. I have diarrhea or loose stool, and this loose stool getting me up from sleep. So this is indicating the severity of those things. Okay. So it will help me in morning and night. Season, it's different like in asthma or something, it's not a specific. But this like morning and night. Also in headache, like morning headache, we have like differential for morning headache. It may be increased intracranial pressure, it may be CO or STA. So by telling me this, I will getting it shortcut my differential. Okay, this is by timing. Then I will get by what worse it, what make it better. What make it worse, what make it better. It's better to say this, not what increase, what decrease. But if it's not big deal, okay? But what make it worse, what make it better, okay? If you have, sometimes I'm a surrogate, I am indicated that I will not give you specific information until you ask it about it. So if in case like headache, okay, you need to know what are the questions you need to ask about it if it works. I mean, we have in headache, we have this increasing by cough, sneezing, leaning forward. So I know this is increasing intracranial pressure. If you ask the third like unleading questions, just open ending questions, he may not give you the answer. So we ask what make it worse, and then ask about it. As like rash, it may be worse by some, by alcohol, by trauma, by stress, by medication. So I need to ask specific about this. Okay, what makes it better? What makes it better? Usually we will tell about what any medication you received or it's resolved by itself. Okay, then we have this since it's a site elsewhere, nature, and severity. The site of problem. In some, this mnemonics in all symptoms, okay, but it will verify from symptom to symptom. I mean, I have symptoms like difficulty in swallowing, so I need to ask where is the difficulty of swallowing. It's in the initiating of the swallowing. It's in your neck, in your chest, okay. But it's like I have loose stool, so loose stool. I will not ask about the site, okay. So you need to know which one will you ask about the site. What about elsewhere? We will not tell him like he has pain, back pain. I will not tell him, is it referred to other side? No. Why? Because no, it's not referred, doctor. Like in cases of FMF, he has pain in chest, and sometimes he has pain in abdomen, and sometimes the pain in the chest differs. Sometimes in the center, sometimes in the right side. So I have pain in the chest, doctor, now in the right side. Is it referred? No, doctor, it's not referred to any side. But any elsewhere you have pain? Yes, doctor, I have pain in my tummy. Yes, doctor, I have pain in my joint. Yes, doctor, I have been anywhere. Okay. So we ask any elsewhere, not where is it referred. Then the nature of the problem, like if the pain, what kind of the pain is, it aching, is it sharping? It's not a big deal, but it helps me sometimes in symptoms like in diarrhea, loose stool. So I need to ask, is this diarrhea? Okay. What is the nature of the diarrhea? Is it watery? Is it bloody? It contain phlegm? It is there is any pale stool, bulky, difficult to flush? According to our symptoms, we have for each symptoms its own questions. Okay. Then the S. S for severity. It's very important. The S for severity. For the pain, we have the score of the pain. I mean, for any pain, we ask the severity, the score. Is it from 0 to 10? How much do you score this pain? Okay. But the most important in the severity is what? Alarming symptoms. I mean, we have in basis for any complaint, we have like alarming symptoms. This is the main symptoms that you need to ask here. Why? Because this is indication, this is a dangerous problem. And it will help me for what? For differential diagnosis. I mean, to exclude the most dangerous problems like malignancy, like HIV. I want to ask about them in the start, in this symptoms. Okay. The second thing is that the symptoms itself, it's complicated. I mean, I have anemia, doctor. Okay, well, this is a simple anemia. When I get the management plan, I will just tell the investigation and the treatment, or you admit the patient. So it will help me to answer this admission. It will affect my clinical judgment. Will patient this patient, doctors, he is needing for admission or not? If patient needing for admission and you didn't admit him, it will affect your clinical judgment for sure. Even if you get the differential, even if you get all of them, okay? And it will affect the safety of the patient because you are affecting, it will affect the welfare because you will affect his safety, okay? So I need to ask about the alarming symptoms for any symptom I have. Then T for trauma. It's not for all, but because most of candidates forget about trauma, so I just put it like, for any symptoms, remember to ask about trauma. because sometimes it's maybe the cause of the symptoms itself, and you ask about all the things, the differential, but you forget because it's just a trauma. And sometimes it will affect the safety for the patient because he gets a headache, maybe because of trauma. He gets seizure. So you need to ask if any injury or trauma for his safety. So it will affect your judgment and the welfare of the patient. So T for trauma. B for pain or headache. I mean, if you have not pain, I mean, I have diarrhea, I have a loose stool, I have anything. So it may be any clue in asking just, do you have any pain at the moment? Do you have any headache? You need any painkillers? Or you can continue with me. It's just like offering him, but it will help you by giving him what? By giving you a clue of something. Okay. This is for the complaint, analysis of complaint. Is it clear? You want me to repeat anything about it? Okay, so this is the complaint. Then we asked about dog bit, get confused since TB. I analyze the complaint very well and finish it. So I will not, I will go for what? I will go for the system related for it and my differential. I mean, this is chest pain, so I will go for cardiopulmonary. This is, I found this is problem in seizure, so I go for the neuro, finish it, okay? Then I will go for my differential. This is well related to asking about the H system. I will tell you after a while how we ask about each system. But just I will tell you the short things, okay? So as we said, we will have the complaint, we will have system related, and then differential diagnosis. Then we will go for this PDF. And yes, what is the BDF? B for past medical history, D drugs, F for family history. This is fixed for all stations. You need to ask about the PDF, even if you don't have anything in the PDF, you need to ask the patient about them. Okay, so don't forget them, and it's easy. You can start even if you don't have sign, you can start examine the patient and then ask about these symptoms if you already know your diagnosis. Okay, and sometimes you will find the answer in this PDF. I mean, this is very important. You need to memorize them very well. What is the past medical history? I ask him, do you have any past medical history? If not, I should be aware of any recent illness, because he may have just like flu, recent flu. And this flu, he get after it ITP. The presentation is purpura, like for example. Okay, well, doctor, I have just recent illness, like he has like chest infection, and after chest infection, he's taking antibiotics, and after this, he got diarrhea. So it may be just the answer in this recent illness. Then any hospital admission, any blood transfusion, any surgery, any procedure. Very important. Why? Because I may ask the patient, any surgery? He will tell you no. Any procedure? Yes, doctor. I sometimes give blood donation because he is hemochromatosis or he is polycythemia vera. Well, doctor, yes, I did radiation before. Okay, he didn't consider it as surgery. So any procedure you did? Well, doctor, yes, I have like dental extraction 2 days ago, and then now presented by myasthenia crisis. So just simple question. Don't forget. You need to memorize all of them. Okay, this is for past medical history. What about the drugs? We say the drugs because BTF, but a drug is used for the IV drugs, doctor. I mean the illicit drugs. So usually we don't ask him, tell me your drugs or the drugs you are taking. No, the medication. Okay. So show me the medication list, please. Would you mind to show me your medication list? Okay. And it's better to tell would you mind to give me your medication list, not show me your medication list. Would you like to show me your medication list? Yes, doctor. I have taken like insulin. I am taking captopril. I am taking statin. I am taking. Okay. Do you have any recent change in the dose? Yes, doctor. I am changing the ACE inhibitor recently, and that's why he is now giving like he is hypotensive or he has renal impairment or whatever the cause. You may have just his answer in this. Well, doctor, I have diarrhea. Okay, I am a metformin doctor for 2 years. Okay, so do you have any change? Yes, doctor. I just changed it 2 months ago. And after that, you have diarrhea? Yes, doctor. So it may be metformin induced diarrhea. Just ask him, do you change the dose or no? Or he may stop the medication, or he ask about the compliant. Are you compliant on this medication or no? Well, doctor, I am like, مثلا, like for example, uncontrolled diabetes, and you will just discover that he is non-compliant on the medication. That's the cause, nothing else. So you need to ask about all of this in the medication list. The dose you are taking. Usually now they are just giving right the medications in the paper, and they give you the paper to read. So I will just read it and tell him any change in the doses recently, any side effect you experience. Are you compliant on them? Yes, doctor. Okay. Do you stop any medication? No, doctor. Okay. What about after the medication list? I ask about over-counter medication or herbal medication. Then I will ask about the recreational drugs. It's not illicit drugs. Illicit drugs, this is offensive for the patient. We need, we can say recreational drugs or party drugs. Okay. For these, before I ask about it, I need to tell him, sorry to ask about its routine questions that I ask for every patient. Do you have any recreational drugs? Do you take any recreational drugs? No, doctor, or yes. Okay. Then ask about any ad or any vaccine. Vaccine, why? Because it's a case common to have this COVID vaccine appeared, and after the COVID vaccine, he just will have palpitation or will have pulmonary embolism. We will have shortness of breath. So how we answer this? Just asking him about the vaccine. So drugs, we're asking about the medication list. Would you mind to show your medication list? What about over-counter medication? Any recreational drugs? Sorry to ask about it, but it's routine questions that I ask for every patient. Any allergy? Any vaccine recently? No, doctor. Okay. Then the family history. The family history, we ask about any similar disease that you have, like you have, runs in the family. Any specific disease runs in the family. This is the main two questions you need to ask for anyone. Then you have two other questions. Any sudden death, any history of cancer. Not for anyone. I mean, if the patient doesn't have, like, we have sudden death mostly in the cardiac patient. I mean, cardiac history. A cancer, if we have like GIT, mainly GIT, and in cases of pheochromocytoma. So it's not in every symptoms that you put these questions. If you have from the practice, you will know. This is a cardiac patient, so I need to ask about the sudden death in any cardiac case. Okay, in cardiac case, ask about sudden death, no problem. But like he has headache and you getting like migraine. So you ask about any sudden death. What is it related to him? Okay. So it's not some examiner don't like it in order to ask it like routine questions. Okay. So this is for family. Any similar disease runs in family. Any specific disease runs in family. Any history of sudden death. Any history of cancer before. And when you know specific symptoms, I will tell you, like in GIT, we need to ask about the cancer and who have the cancer and the age of the cancer. The sudden death, who get the sudden death and who and at what age. Why? Because it differs from me. I mean, he has like chest pain and ask family history. He has family history of sudden death or ischemic heart disease for my father, doctor. At what age? At 65. This is not positive family history. Okay. And they like this in basis. I mean, they play on this in cardiac. They like very much to give you positive family history, sometimes significant and sometimes non-significant. And they play for both. Okay. Also the cancer. The cancer, I have my uncle, doctor. Okay, at what age? At 60. Okay, but it's a significance less than 50. So is it significant family history or no? They want to hear from you. Okay, so ask about who gets this problem and at what age. This is for family history. Let's go for travel. What is the travel history? Travel history, we ask him, where do you travel? If he has any travel history. Do you have any travel history? Yes, doctor. Where? When? and the duration of stay. I mean, where do you travel to Spain? When? Last month. And you stayed about 2 weeks, doctor. Okay, and then asking before, during, and after. Before it, any vaccination, any prophylaxis you need to take, and you take it or no. Okay, during, I need to ask him, where did you stay, and what food and what water. I mean, you eat food and water from the hotel or from the street. So it may be like infectious diarrhea. He is getting like infectious diarrhea. So from this, he has like jaundice, and it may be hepatitis A. This is common. So I need to ask him about the food and water. And then the activities, like he is going, we were hiking, doctor. Okay. And he is now getting by a rash. This is Lyme disease, maybe history of tick bite. No, doctor, we were hiking and we were like to go for mountains and caves, and then we have cough and the hemoptysis. This is bronchitis. This is aspergillosis. So it may be just the answer in the activities. Then the mosquito bites for malaria. Do you have any history of insect bites or mosquito bites? Well, yes, doctor. And now I have just a headache, and I have like fever, headache, and loss of concentration. You may have meningitis, but because of malaria. Okay. So I ask about the activities, mosquito bites. Then I will ask about what may I ask some private questions. I ask it for all of my patients. Yes, doctor. I will ask about the sexual here, because any long-term relationship, yes or no, any casual partner while you are traveling, male or female, do you practice safe sex, any sharing needles, any tattooing or piercing, any procedures when you are traveling. I'm still in traveling, okay? So I need to ask about sexual even in the traveling. Then after it, did you complete your vaccination, your prophylaxis? Some cases just he didn't complete the vaccination after he returned, and then he started to develop this malaria symptoms, meningitis. He gets fever, he gets headache. Okay, just the answer will be just I know I didn't complete the prophylaxis. And the onset of the symptoms, I mean, it's after returning by 1 day, 2 days, by 1 week, by 1 month. It will differ for me according to the symptoms that he had. Okay, so this is for the travel. Then, if you don't have travel history and you need to ask about the sexual, it's the same. Any long-term relationship, any kids, any problem in intimate relationship, according to your symptoms. Okay. Any casual partner, male or female, any safe sex, any needle sharing, any piercing, tattooing, any procedure. So this is for the sexual history, okay? So this is the PDF and TS, travel, sexual, plus medical history, drugs, family, T for travel and sexual. Any question regarding this? Okay. So after this is just that. What is just that? J for job. Job, what do you do for living? Is it new? I mean, do you have any previous job or no? When specifically I want to ask about the job and the job before in the chest cases, especially. Why? Because the chest usually maybe like he was a farmer and now he is like a taxi driver, okay, and he is getting history of chest cough, hemoptysis. He has bilateral crepitation, so he may be like while he was farmer, exposed to some fungi, getting aspergillosis, but he's changing his job now. Well, doctor, I am an engineer, and now I am changing the factory. I am now in like lead factory or something, asbestos or whatever. So he now gets asbestosis because he changes the factory. So the chest, they like very much to ask about the job and the previous job. Okay, and even if he retired, what's the job before he retired? Other part is to ask about any part-time job and hobbies. They like it in the cases of hokum, in cases of epilepsy, adult polycystic kidney disease, It will help you also in the communication. Why? Because it's dangerous from this, like to giving exercise. So sometimes I am engineering doctor, but after I finish my work, I exercise. I like to train football. I play football a lot. Well, I am gym trainer, whatever. Okay. So just a tricky part, I will need to advise him to stop this. This is for his safety. When I ask about the job, it's very important to ask about the impact. The impact of what? The impact of these symptoms on him. Are your symptoms affecting your daily life activity and job? Yes, doctor, it's affecting me a lot. I can't go to my job. I can't do my usual activity in the home. What I should say, I'm so sorry for that. We will refer you to, if the problem in the job, we have the occupational health care officer. If the problem in his daily life, this is the social worker. So if I have problem in my job, I can't go to my job doctor. So is it acute problem? I mean, this is like he has just a seizure for 1 day. Okay, so I can give him sick leave. Or is it chronic problem? If it's chronic problem, it means you may need to reallocation, or they may need specific things in his job. So I will refer him to the occupational health care officer. This is for the job. What about the well, yeah, doctor, I have problem in daily life activity. I don't have anyone to take care of me. I have financial trouble. This is the social worker. Okay. So the social worker, the social issues that we need to ask about it. With whom do you live? Who is taking care of you? Anyone dependent on you? Are you financially supported? He may tell you yes, doctor, or no. If no, okay. If yes, I will refer him to what? To the social worker to see how we can help you. Some candidates, they tell him, I will refer you to the social worker to solve your problem, or I will refer to the occupational health care worker and he will deal with your problem. Don't give anyone promise. Just he may help you to see how we can help you. Okay, so don't give a promise. Tell him that we will refer and we will try to help. Okay, which one is specifically I need to ask about this social issue? I mean, and for every patient, you need to ask about his job. You need to ask about the impact. Okay, but the social for details, it's not for everyone. Mostly, if you have problem with daily life activity, I mean, the patient is rheumatoid arthritis. He has a problem in dealing with even opening the jar in the house. He can't deal with his daily life. So I need for him to ask about all of this. Anyone taking care of you? Are you dependent, financially supported? How you are taking care in your home? Can you deal with daily life activity? Well, no, doctor. So I am sorry, and I will refer you to social worker. Can you help you with occupational therapist, specific dietitian? Okay. So I will need to offer a lot of help for him. Okay, what else? Patient with risk of fall, like he has Parkinsonian, he has dementia. So in this patient, I need to go for details in social. Okay, need patient is palliative care. He is needing to take care of him. Very important for him. So I need to go in deep for this. Okay. What else? The financial. If anyone tell you that I have financial problem, you need to refer him to the social worker. And if you anyone that you expect that he will have financial problem, like patient, he is driver and you now telling him to stop your job. He is firefighter and you tell him to stop. So you now that chef with allergy and you tell him that stop. You can't be a chef again. So in this patient, I need to go for financial a lot. Okay. This is for this financial, yes, stress. Any person with problem like stress, it will help you more in of course in communication, not here, but I just mentioned for it. Like suicide, traumatization, convergent disorder, you need to ask about stressful condition, and so you will offer the social help for him. Okay, so this is just job, impact, and social. Okay. Then go for SAT. SAT, this is smoking, alcohol, and driving. Smoking, we have certain questions. How many cigarettes per day? For how long? It will tell you whatever. I am taking 2 cigarettes for per day for about 10 years now. We will tell him smoking is harmful for your health. It's advisable to stop smoking. Okay. For everyone, for anyone, you will tell him the same sentence. It's harmful for your health, whatever. But if the symptoms is related to smoking, like he has shortness of breath and he has problem in his chest, so smoking here is hazard because of this problem also. So I need the examiner to listen to me that I am telling him I understand that smoking here is affecting his problem also, not only the in general. Okay. So if it's specific to someone, tell him. And then I will tell him I can refer you to smoking cessation clinic if you don't. The same is alcohol. How many units per week? For how long? He will tell you about 1 unit, 2 unit, okay. But before you ask about this, you need to verify what are you aware of safe limits? Why? Because not all the surrogates or not all the patients should be aware of what is the meaning of unit. He knows that he is drinking like half bottle of beer. He knows that he have like five glasses of champagne, but he doesn't know what is the unit. Okay, so you need to ask him. Mostly, as basis wise, they will tell you the units. Mostly, unless the case is related to alcohol and the examiner wanted to examine you about this alcohol. I mean, he wanted to know if you know the how to calculate the units of alcohol and how you ask about it. Okay, it's a rare, but it happens once or twice. It may happen, especially in UK. Okay, but most of cases you will find that he will tell you I drink socially, not I'm not over limits. uh, okay, what is the over limit? What is the units? Usually 14 units. If he tell you I am drinking about 16 units, doctor, so he is now over the limit. Okay. Okay, I am drinking socially, doctor. So what about the weekend? Why? Because we have the binge drinking. I mean, he may just taking like 5 units per week, but he binge drinking and he now getting by palpitation, and this is the alcohol, cardiac alcohol syndrome. Or he is over drinking and this is causing his trauma and get vertex encephalopathy or whatever the binge drinking is. So sometimes it may be just as a binge drinking. And I will not tell about the binge drinking because this is like against his welfare. So I just ask him any over drinking in the weekend. Yes, doctor. Okay, what about the last days? Okay, I tell him how many units, especially doctor, like 5 units. What about the weekend? No, doctor, I don't have any over drinking. What about the last days? Well, doctor, yes, just the last days I get over drinking. Okay, so it may be, or just the last days, doctor, I didn't get any drink because he was admitted in hospital, so he can't get with this. So he now getting like a recurrent seizure because just he is just stop drinking. So just ask him about this question. So about alcohol, how many units per week? What about the weekend? Any over drinking? And what about the last days? Any over drinking or you cut down the drink? If your problem is alcohol, like I have my problem now, he is over drinking. Okay. So he is usually, if you found the patient over drinking, mostly they will put it in the diagnosis. I mean, they wanted you to put it in your differential. So if I get patient with alcohol overuse or overdose, I need to ask about what we call the cage. What is the cage? CAGE. Cut down. Do you feel that you need to cut down your alcohol intake? Do you feel that you are annoyed or people are starting to annoyed about your consuming of alcohol? Do you feel you are guilty about this? Do you feel that you need alcohol just when you open your eye in the morning? This is the key for the cage, because if it's a high score, this is meaning this alcohol abuse. It just we need it if you have over drinking alcohol and you have like related to your symptoms. Mostly the case like alcoholic cardiomyopathy. Patient shortness of breath, you will find heart failure, and you will screen all of the causes. Mostly you will find just the alcohol over intake. So ask about it. Okay, peripheral neuropathy, and just because he is over drinking alcohol. Um, Blurring of vision, optic atrophy, and he has history of alcohol over intake, whatever like this. Okay. If he, whatever he say to me, this is over limit, well, we need to moderate your alcohol. The alcohol don't stop smoking. We stop the smoking. For alcohol, we just moderate it. I can send you to alcohol anonymous group. There is no clinic for alcohol, just groups. Okay, if you don't mind. Okay, so we tell him in polite, moderate the alcohol, and just anonymous group. This is for the alcohol. Okay, okay, let's go for the driving. What about the driving? The driving, we have two groups. Group one, group two. Group one, the normal person who is driving his car, his motorcycle. This is group one. This is less strict. And the group two, the patient with heavy vehicles like bus, like lorry, all of this. It's a problem in what? In the taxi driver. The taxi driver in Scotland and Wales, I think, they consider it as group two. In England, still no, but according to your case, okay? But let's say that's group one, car, motorcycle, group two, mostly for anyone who is carrying people. I mean, even taxi driver, if he is carrying people, so he should be for group two because of the safety. And when I ask you, ask as a patient, do you drive? Why asking about this? For two things: to help, to ask, to tell him to stop no the driving, and to inform the DVLA or no. I mean, you need to stop driving or no? We need to inform the DVLA or no? How I should know? You have like DVLA restriction. I will share it in the group with you. Just the problem in anyone who has problem in his eye, stop driving. Any problem in the heart or the neurons, mostly stop driving. Hypoglycemia unawareness, stop driving. So this is the main. Sometimes they will ask you for how long all these. You need to go for this table and memorize them. Okay, with practice you will know them. But just remember, because it will affect your safety. I mean, the welfare of the patient will be affected by that if he is like having problem in his vision and you didn't ask him to stop driving. It will affect the welfare of the patient. Okay, this is for the driver. So this is for just that. Is it clear? Okay. So let's go for 4Bs. 4Bs for the pregnant, okay? Because it's private questions, so I will tell her, excuse me, can I ask you some private questions? Yes, doctor. Can I ask you about your period? Any chance of pregnancy? Any history of abortion? Do you have any contraceptive measures? And it's contraceptive measures, not pills, because she may use pills and others. If she is old or above 45 years old, we can ask about the hormone replacement therapy or any medication you are taking. We will not take the hormonal replacement therapy. Any medication, any contraceptive measures. Yes, doctor, I'm taking replacement therapy, I'm taking OCB, whatever they will tell you. It's very important, yes, in some cases like thrombophilia and lupus, they like OCB, like idiopathic increase in intracranial pressure, the OCB. So we need to ask about them. How I memorize them? Just she is a girl, and the girl first start to be getting a period. Then she get married and pregnant. Then, unfortunately, she gets abortion, and since then she is using pills. Okay, until she gets old, and then using hormonal replacement therapy. So, period, pregnancy, abortion, pills, and hormonal replacement therapy. Okay, this is for 4Bs. Then the system review, as we said, let's go for this system review. Before I go for this, any questions regarding all of the previous ones?